My name is Jessica Barnes and I am a senior in the Exercise and Movement Science program. I am going to be talking about the analysis of kicking a soccer ball. There are many different types of kicks used throughout a soccer game. The three that I am going to focus on are the instep kick, the push kick, and the inner side of the instep kick. The first kick is the push kick, which is also known as the inside of the foot kick or side kick. The push kick is the most basic movement of soccer and is taught at the novice levels. It is used for about 70% of the game for sending short passes to teammates. According to Castellanos, Fajardi, and Suarez, during an average 90-minute game, a player has approximately 51 contacts with the ball, 26 of with the feet. Not all 26 kicks would perfectly execute side foot kicks, but the accuracy of any kick can improve with practice. This article focuses primarily on the basic anatomy of the kicking foot. According to Castellanos, Fajardi, and Suarez, in order to execute a side foot or push kick, players must strike the ball, which involves the medial or inside aspect of the foot. The kick is an essential skill required to play soccer. This kick is taught at novice levels but carried on in practice throughout elite levels. The player uses different muscles and bones for each scenario of running and stationary kicks. As stated before, there are many different muscles being activated depending on the movement of the specific body part. During hip flexion, the muscles being used include the psoas, iliacus, rectus femoris, pectineus, sartorius, and tensor fasciae latae. During hip extension, the muscles activated are the gluteus maximus, the biceps femoris, semitendinosus, and semimembranosus of the hamstring. Along with hip flexion and extension, the hip also goes through abduction and adduction. Hip abduction involves the gluteus medius and gluteus minimus, while the longus, brevis, magnus, and gracilis aid in adduction. During knee flexion, the hamstring muscles and the sartorius are activated. The rectus femoris, vastus lateralis, intermedius, and medialis of the quadriceps aid in the extension. These muscles work together to move the femur, tibia, and fibula at the knee joint like a hinge, allowing for the foot to accelerate towards the soccer ball. Some of the main muscles connected to the ankle include the anterior tibialis, gastrocnemius, and soleus. The anterior tibialis along the shin aids in dorsiflexion, while the gastrocnemius and soleus aid in plantar flexion. The medial bones, such as the medial cuneiform and navicular bone, experience the most contact with the ball. The calcaneus, fibular, talofibular, and tibiofibular ligaments act as shock absorbers during ball contact. The next kick is the instep kick. The instep kick is also known as the laces kick and relies on the upper surface of your foot or where the laces lie on the spike. There are different steps leading up to this kick in order to allow the player to have power behind their kick so they are able to shoot, cross the ball, or execute corner kicks. There are 5 steps of the instep kick. The first is the approach or preparation, which starts with the heel strike of the kicking leg and ends with the toe off of the kicking leg. The second step is the backswing or planting the foot, which starts with the previous step of the toe off of the kicking leg and ends with the maximum hip extension. The third step is the cocking of the kicking leg. Again, it starts with the prior step of the maximum hip extension and ends with maximum knee flexion. The fourth step is acceleration, or the actual swing of the kicking leg, which starts with maximum knee flexion and ends with making contact with the ball. And finally, the final step is the follow through, which begins with ball contact and ends with toe speed and flexion. There are many different bones within the ankle, hip, and knee joints that are used during an instep kick. In the hip, the femur and pelvic girdle form the ball and socket joint that is the hip. This is important because the ball and socket joint allows for multi-directional movement of the hip. The femur and tibia form the knee, which is a hinge joint. This is important because the hinge joint allows the knee to flex and extend to kick the ball. Lastly, the tibia and calcaneus form a modified ankle joint. Just like the push kick, there are many different muscles used during the instep kick, some of which are the same as used during the push kick. During the preparatory phase of the kick, the hip performs extension and hyperextension with the help of the agonist glute muscles. Agonist muscles are those that contract while other muscles relax. The glute muscles used include the gluteus maximus and minimus. During knee flexion, the hamstrings, including the biceps femoris, semimembranosus, and semitendinosus, act as agonists. The ankle performs plantar flexion with the gastrocnemius acting as the agonist. During the kicking phase, the hip performs flexion with the iliopsoas muscle acting as the agonist. Knee extension is performed with the quadricep muscles acting as agonists. The quad muscles include the rectus femoris, vastus medialis, and vastus intermedius. The ankle again performs plantar flexion with the aid of the gastrocnemius. According to doctors Anderson and Seedaway, kicking-like kinetics are characterized by a complex blend of forces generated by muscle moments, motion-dependent moments that result from interactions among joints and segments, and gravitational forces. Hip flexion moments are nearly twice as large as knee extension moments, and the smallest moments are associated with ankle plantar flexion. The interstep of the instep kick is basically just a modified version of the instep kick. It is typically used for long distance passes and uses a little less force than the instep kick. With any sport, there is always a high risk of injury, whether it is due to contact, improper training or technique, or overuse. Some of the most common soccer injuries include the hip flexor, meniscus tear, ankle sprains, groin strains, and ACL tears. The hip flexors are a group of muscles that help flex the femur onto the lumbopelvic complex, which pulls the knee upward. The hip flexors are triggered every time you kick or punt a ball. Common causes include overkicking, not getting enough rest or recovery time, and overuse. Symptoms include cramping or pain in the upper leg, muscle spasms of the hip or thigh, and tightness or stiffness after being immobile. Treatment includes the use of nonsteroidal anti-inflammatory drugs, rest, and ice. The meniscus is a C-shaped disc that cushions your knee. Each knee has two menisci that act as shock absorbers. The meniscus tears when the pressure outweighs the shock that the meniscus can bear. A meniscus tear can occur if a player is twisting or turning too quickly. It commonly occurs when a player plants their foot oddly next to the ball while kicking. Signs and symptoms include swelling, pain upon touch, restricted movement in the knee, and the feeling of having your knee lock up. Treatments include stretching, physical therapy, nonsteroidal anti-inflammatory drugs, rest, ice, and surgery in the worst cases. Ankle sprains are one of, if not the most common injury in soccer and can range from mild to severe. There are two types of ankle sprains, inversion and eversion. Inversion occurs when the outer ligaments are stretched too far. This is the more common of the two. Eversion ankle sprains occur when the ankle rolls outwards. Common causes include sudden stops or changes in direction, planting the foot the wrong way, or landing unstably from a jump. Signs and symptoms include pain and tenderness, swelling, bruising, stiffness, and inability to bear weight. Treatment includes icing, resting, stretching, physical therapy, or bracing the ankle. A groin strain is a tear or rupture to any of the hip abductor muscles and can range from mild to severe. Causes include sprinting or changing direction quickly, resistance during rapid leg movements such as kicking, or overstretching. Signs and symptoms include groin pain and tenderness, muscle spasms or tightness in the groin area, and discomfort with walking or running. Treatment includes compressing the thigh with a bandage or tape, NSAIDs, and icing the inside of the thigh. The ACL is one of four major knee ligaments that stabilizes the knee. Common causes of an ACL tear include rapidly changing direction, stopping suddenly, slowing down while running, or direct trauma such as a slide tackle in a soccer game. Most people will usually feel a pop in their knee at the time of injury. Treatment consists of arthroscopy or ACL reconstruction accompanied with physical therapy.